Hello, folks. I'm Ellen. I am coming back to you about my post op. This is part 3. First of all, I want to tell you, and I cannot express enough, do not be afraid. Do not be afraid of all the stories that you heard about the uterine artery embolization. Do not be afraid. 24 hours or less of pain is worth more than losing your precious organ that God gave to you for you to have babies. That's your uterus is a part of you. Prevent getting a hysterectomy. Do not listen to your gynecologist, OB. They first thing they want to do, fibroids. If you're bleeding hard, you're losing a lot of blood, and it's causing you to be anemia, first thing they want you to do is to get a hysterectomy. Do not get a hysterectomy. Do not listen to them. Research on your own. As I said in my part 2 and part 1 videos, that I was at the hospital. My hemoglobin was down to 4.5. I refused a blood transfusion. I basically told them that I wanted to get the iron infusions. The iron infusions do work. It takes a couple of days to start getting your blood levels up. As long as you're not hemorrhaging or losing too much blood, it can get it up. So if you used to being anemic, don't get a blood transfusion. You don't need one. Your body replenishes itself. I'm a prime example of it. I did not get a blood transfusion, and today my hemoglobin is a 10, and it's still counting and going up. Anyway, the post-op, what happened when the day of my procedure. I got my procedure done at Advocate Lutheran General Hospital in Park Ridge, Illinois. Dr. Dines, Dines, look him up. Excellent doctor. I couldn't have asked for a better doctor. He did. He explained the procedures. He explained the pros and cons. He explained what could possibly happen. But this is a less invasive surgery, so it may work for some folks and it may not work for some folks. But I would strongly suggest to give it a try because at least you'll know. Plus, it also give you opportunity to have kids because if you have uterine fibroids, it's very hard to get pregnant with the uterine fibroids. So the things that the doctors always want to do, they want to do a hysterectomy. No. Say keep your organ, research it, find you. I prefer you to find it a radiologist in the hospital because that's where I got it at the hospital. That hospital settings, it's more if anything goes wrong, if there's any kind of emergencies or anything, the facility is there to be able to equip for any emergencies. Although there is local clinics that do this procedure, but I highly recommend the hospital. This type of procedure is not really known to a lot of women because a lot of women don't know it. It came introduced into the United States around 2002. Condoleezza Rice, which was you may be familiar with, she was one of the first 5 women in the United States to get the procedure. So after that, it became popular and popular. So since 2002, it's been growing. Last year, the United States performed 14,000 uterine artery embolization. So it's very, very safe procedure. Any procedure you get is going to be dangerous. If you get a hysterectomy, dangerous. If you get a uterine fibroid, dangerous. Anything we do in life is going to be something that's going to happen. But I urge you, do not be afraid of this surgery. I was so scared. And I'm like, wow, I'm scared. This is it? This is what happened? Don't be afraid. Your gynecologist is not going to tell you about this procedure because if you don't listen to their recommendation of getting a hysterectomy, you are taking revenue out of their pocket. And when you get the uterine artery and embolization, you're given the revenue to the radiologist department, because the radiologist doctor is the one who performs this surgery or procedure, which is less invasive. So anyway, let me shoot right into real quick with what happened to me. The day I was already in the hospital when I had this procedure done. So they rolled me down, they got me in, and they, got my IVs ready to hook up the PCA, which is the morphine pump for possible pain. And then they rolled me into the room where the surgery is going to be take place. And they laid me flat on a flat table, just like an x-ray table, but it's a thinner x-ray. And then they, have one arm with that has your pulse in it, and the other arm has your blood pressure is constantly being set up. So they basically setting you up for all your vitals, and then they put the oxygen mask into your face, into your nose, and then they lay you flat, get you all comfortable, put all the sterile stuff on you that needs to be done, to perform the procedure. And then they shave the area that they're going to insert the catheter in, to get that preparate, and they clean it real good so that it's sterile. And then the doctor comes in. Once the doctor comes in, that means it's time to proceed with the procedure. So when the doctor comes in, he proceeds with the procedure. Everybody's there. Everybody that's a part of the team is standing around getting ready to get this procedure underway. So I'm laying there. The doctor said he's ready. So I'm sitting there. Okay. All right. When am I going to go to sleep? When are my eyes going to go away? When am I going to start being in a twilight zone? And I'm looking around, and I'm like, okay, I feel something going inside my leg. I feel something coming inside of my body, but I'm not feeling anything, but I'm awoke. I'm like, really? So I'm like sitting there, and I'm like, okay, it must have been about 10, 15, 20 minutes going by. I said, I guess I'm not going to sleep. I'm not, I'm not going to be sedated, but I was really sedated, but I was aware of everything that was going on. I'm looking around, looking at everybody. Oh, and they also asked me, what kind of music you want to listen to? I say, I want to listen to Drake. So I'm laying there listening. I'm looking around, seeing everybody doing stuff, getting me ready. I still feel the stuff going inside of my body. And so I'm hearing Drake. So I'm sitting up there jamming off of Drake. So I'm like, I'm not moving, but my hands is moving. I'm like, okay, like all the hits of Drake they was playing. They had it blasting in the surgery room. It was pretty cool. But I was just laying there, and it's just minutes and minutes went by. I started at 9:20. I don't know what time it was, but I tell you, once he finished, he told me, he said, well, we almost finished, Ellen. And I was like, okay. And so next thing I know, he started pulling the tubes out, because of course you know about the procedure. He pulling the tubes out, and then he pulled the tubes off, and then he put his hand on the artery to stop the blood, because of course you're going in the artery. If you don't stop it, it can bleed to death. So he's holding that down and stopping the blood, and then he held that down for probably about, I don't know, it was a minute, so I would say about 10 minutes. And then he put the Band-Aid on it, and then he was done, and then it's like, okay, you can go ahead and take her. They start unstrapping me, getting me off the table and stuff. And by then I started sweating. I was like sweating. I'm like, it's hot in here. I said, why is it so hot in here? So I started taking stuff off. I started moving my shirts and everything. I'm like, man, I'm hot. So I'm like, I'm just super hot. So by the time they got me into the recovery room, I'm like super hot. I'm in pain, but I'm not even noticing the pain. And but you can't move because you have to lay flat on your back for 2 hours. So I'm sweating, and finally I start moving stuff around, and I'm like, man, I need to stand up. I need some air or something. And then I'm feeling the pain, but the pain is like, okay. So she was like, okay, well, you got to lay flat, Ellen. You can't move because you have to stay flat, because that artery it takes 2 hours for it to start closing up, and so that it can stop any kind of leak, for it to for it to heal. And that's the wonderful thing about our body. Our body heals itself. And so I'm like laying there, and finally I was like, man, I'm not getting up. My leg is down. I'm like, I can't move. I said, so I just started breathing in, and I just started just like getting relaxed. I said, well, I'm starting to feel pain. She said, well, we setting up, push the button. Is the button right here. All you got to do is push the button and you get the morphine. I pushed the button. So I'm laying there, I'm still hot. I'm in pain, but I don't know. I noticed the heat, me being hot, more than the pain. So I had the pain. Finally, the 2 hours went by, and it was able to roll me up the room. They got me up to the room. By the time they got me up to the room, I was like excruciating pain. The pain is literally labor pains. Your uterus is contracting from the blood tract circulation's cutting off from the procedure, because that's what it does. It cuts down the blood. It cuts down on the blood circulation, and then the fiber starts. It's no longer living. So because if you have a lot of them, then you're going to have that pain, which is contractions of the labor. The pain is contractions of the uterus, basically like labor pain. So I'm giving myself morphine while I'm so in pain. I'm like, I'm in pain. And then I started throwing up. Anytime you get any kind of opiates, any kind of narcotics, you're going to throw up. Don't worry, because when you throw up, it makes you feel better. You're not all nauseated, like deadly nauseated. Don't trip. It's just throwing up. When you throw up, you feel better. So don't trip about the being nauseated. Don't trip about the pain, because the pain is going to go away. So eventually there was a doctor that came in. Her name was Dr. Brennan. She said, take her off of the morphine. Take her. So they took me down off. They took off the PCA. They said, she said, you do not give a woman that's uterus that is contracting opiates, period. So she ordered a high dose of ibuprofen, and she also ordered for me to have a muscle relaxer. So they took off the morphine PCA, then they shooted up some high dose of ibuprofen. There's a special name for it, but it's a higher dose. The hospital knows. And then they gave me the muscle relaxers. When they did that, the pain decreased like 75%. I still had some pain, but that pain went down. So, women, do not trip about the pain, because the pain can be fixed. Come off the morphine. When you first come out of the procedure, yeah, take the morphine, because that's what they're going to do. But as soon as you get into recovery room, if the doctor do not give you the high dose of ibuprofen and the muscle relaxer, just tell them to give it to you. Believe me, the pain will stop. Ibuprofen, muscle relaxer for the pain. My pain went down 75%, and as the hours progressed, the pain just kept going away. And eventually I was in pain for 24 hours. That was it. The second day I had a little, just a little pain, but all I had to do was take ibuprofen, and I didn't have it anymore. The main thing was I was tired. I was exhausted. So I slept a lot. And, and also after the procedure, I had some post bleeding, which could happen. Some women will have the post bleeding, some won't. I had the post bleeding every day up until yesterday. So I had my procedure December 20th, 2018. Yesterday, which was January 10th, 2019, the bleeding stopped. So it was spotting, spotting for and it wasn't a period, it was the fibroids coming out, but it wasn't abundance, it wasn't a whole bunch. It was 3 weeks, which was tolerable compared to the cycles I had before that. So my doctor, Dr. Dines, Dines, he said, I can fix your problem 85%. You will still have your cycle, you will still have your periods, but your cycles will be 85% improved. Hey, 85% improved means I'm normal, like the other normal woman that's walking around having a normal period. Well, we shall see. We're going to see if that happened. I have confidence it's going to happen. Oh, and also, my stomach is going down. I look at it. My stomach is shrinking that by the day. I used to look like I was probably 8 months pregnant, as you guys see on my first video, part 1 and part 2. No, I'm not. Stomach is going down. That's what those fibers. So those fibers are shrinking. They're shrinking. So if you have any questions, please subscribe so that you can hear about my next period when I have it. Subscribe to me and also like the page. I'm new to this YouTube thing, and I just really want this to get out and educate women. You have control of your body. You can get this procedure and you can have a baby. If you don't get the procedure and you have the fibroids, they continue to grow because of our diet, what we eat in our food. They continue to get bigger and bigger. And it's more than likely a woman cannot get pregnant when they have fibroids. Some do, but it's very, very, very slim. So this procedure gives you an opportunity to get pregnant, because now the fibroids are shrinking and you have a better chance of holding a baby, carrying a baby in your uterus. Do not get a hysterectomy. I repeat, do not get a hysterectomy. I am a prime example. I had the worst cycle than most people living in this world. Believe me. Hemoglobin 4.5. That's how bad it was. I was hemorrhaging. Do not get a hysterectomy. I'm 52 years old. I've been dealing with this all my life. You keep your organ. God gave it to you. Stay tuned for part 4. I can't wait to see what happened. 85% improvement. I will let you know. Good luck. Research. Get a consultation. Go get that procedure.